Hey guys, what's up? It's Cody, and today is my 9 months on testosterone. So I didn't make an 8 months on testosterone. I got caught up in this thing called Vita, which was vlog every day in August, and that was super fun, but I forgot to post an 8 months update. Last month I had a bottom surgery consultation with Dr. Crane in San Francisco. I went in there kind of citing towards metoidioplasty for the procedure that I'd be more interested in, but by the end of the consult, he had me on the list for phalloplasty in 2017. So here's how it all kind of started. Number one, my insurance does cover it. However, I do have a copay of 20%, but I have a max out-of-pocket fee of $2,000. So it doesn't matter if it is a $30,000 procedure for the meta or $100,000 for the phalloplasty. I only have to pay $2,000. And I say only because it's a lot less than $100,000. And I still don't have $2,000 lying around anywhere. So that is one hurdle that I will have to jump over somehow. So metoidioplasty, it's great for like sexual sensation, and the recovery time is less. He says there's about the same complications, but I feel like it's a little bit not. I don't know. I don't believe him completely on that one, just because phalloplasty is so much more involved. So, anyways, sensation with metoidioplasty is great. Downside is your phallus is as big as a thumb, probably your thumb or someone else's thumb. I don't know. So if you just want to stand to pee and you want good sensation, then metoidioplasty is probably going to be fine for you. If you want not only to stand and pee, but you want penetration, then phalloplasty is probably... Hi, Delilah. Hi. I'm house sitting. Your dog sitting. She's so sweet. Oh yeah, she's so mega. Anyways. No. Alright. So, yeah, phalloplasty is better for penetration and stuff like that. Obviously, your phallus is going to be more of a normal size, obviously proportion, but it'll be bigger than your thumb. So that's the plus for that. The difference in procedures, so phalloplasty, they take the skin from your arm, which with my arm, they would actually have to use my right arm because I have a tattoo on my left arm. And even on my right arm, I would still have the butt of the pig on my dick. So there's that. And they take skin from your leg to cover up the skin that they take from your arm. So my arm would be in a splint for like 4 weeks, and I'm a cook. I'm constantly using my arm, so to have my right arm in a splint, left would be like bad enough, but I can't imagine going through the recovery process of phalloplasty, especially in my line of work, and I'm an athlete, so to think about the recovery time, not being able to train and stuff like that just kind of blows my mind. So I'm really weighing that as a factor. I have to think about the long run. I know that getting past the recovery and moving on is something that would be great, but it's such a risk for me. So the recovery is what really holds me back with phalloplasty, and the complications that could happen are so scary. I don't even want to think about it. So, metoidioplasty, less recovery time, and there's no scars. Like, they aren't taking any skin from your body. They're just using what you have down there naturally that is grown from testosterone. So Dr. Crane said that most guys' lower growth maxes out at 18 months. So I would definitely wait another 9 months, obviously, to have metoidioplasty. So I have time to think, and he told me to really think long and hard about it, because if I choose one, like it has to be the one that I'm happy with, because insurance is probably not gonna pay for 2 procedures. Like if I have a metoidioplasty and I'm not happy with the size, they're not gonna want to pay for a phalloplasty, which the majority of his phalloplasty patients are metoidioplasty patients that were unhappy with the size of their phallus. So that is something to think about. I'm definitely thinking about that really hard. One day I'm all like, meta, definitely meta, and then the other day I'm like, well, this would be nice when I think about phalloplasty. So I'm still kind of on the fence. Let me know what you guys think about it. And yeah, right now my next step is to have a histo, because either way you have to have it for both of these procedures. And so I'm going to take that step, and I'm going to decide from there what my next step will be, if any. And my consultation for my hysterectomy is September 18th. So that's coming up next week, a week from today, actually. So yeah, I think the greatest, for some reason, I do kind of, like, I think about the parts that are inside me. There's some guys that don't, they just say, like, it doesn't bother them because they can't tell that they have, like, their female organs and stuff like that, but it does bother me. And I think about the hormonal battle that goes on inside my body every single time that I inject testosterone. So it'd be nice to not have that battle of testosterone versus estrogen, like, constantly. That really just, it concerns me, because hormones are pretty powerful. So I feel bad for my body just constantly battling itself, and I don't want that anymore. I don't want to think about that anymore. I just want that out, and I want to move on. And that is where I'm going to go from here. And I'm going to do a lot of thinking, and maybe even blogging or whatever about it. So stay tuned. Let me know any of your guys' thoughts or experiences, and I will see you next time. Peace out.